After 14 years of civil war, most of Liberia's infrastructure has yet to recover. More than 1/3 of the population lives on less than $1 a day. Malnutrition, respiratory infections, and preventable diseases such as malaria and measles contribute to making the country's infant and under 5 mortality rates amongst the 5 highest in the world. I recently caught up with Ibrahim Sesay, head of child protection at UNICEF Liberia. We began by discussing the current situation for children in the country, and I asked him to tell us a bit about what UNICEF is doing to help.
Under child protection, there are 2 major components that we have as a program. One is child justice, and then the other is social protection. After a 14-15 year civil conflict, government institutions are very, very weak. You have poverty that is very, very rife. And at the same time, basic social services, which should be taken for granted, are non-existent in most parts of the country. So in this sense, you find out that the areas related to child survival and child development are really threatening the existence of every child in Liberia. I give you an example so I illustrate what the Liberian child and the situation is like. If you have Joe that is born in Liberia, in a very remote location in one of the 15 counties, Joe hasn't got access to birth registration and a birth certificate. Joe hasn't got access to a health facility that is 30 kilometers close to his house. In terms of schooling, Joe is one of the children, 63% of them, who should be in school but is out of school. Joe is one of the children who do not have a robust legal framework in terms of protecting their rights. Joe is one of those children who suffer child hazardous work, both within his own community, and then Joe is one of those kids who faces things like violence and exploitation. So this is the sort of Joe in a post-conflict Liberia where Joe lives. And in this sense, the duty bearers who are Joe's family and parents are being exploited by individuals with false promises, taking Joe from that community, say the best place where Joe could thrive is in an institution or an orphanage. And Joe has the likelihood to be trafficked and then be taken into another country under the guise of inter-country adoption. So that is the situation of children that we see in Liberia.
What key area is UNICEF targeting to improve the situation for children?
You only have 4% of children in Liberia whose births are registered. So UNICEF and other partners have been provided both technical and financial support in building the institutional capacity of government to have a decentralized birth registration system. UNICEF in particular has provided the technical leadership where now we have been able to develop a management information system for birth registration. And between now and 2012, we should ensure that 80% of children, moving from 4% to 80% of children under the age of 5, all of those births should be registered and then issued a birth certificate.
Can you describe an innovative project that UNICEF is working on at the moment?
As a result of the global financial crisis, taking into account the rise in food prices, and then tackling poverty, which has been a hindrance for children to have access to healthcare, nutrition, as well as education, we have come up with a social cash transfer program. It's in a pilot phase. It's an operational research that we're currently doing. But we've really seen some quick gains in this particular program, wherein most of those children who should be in school are not in school. But this program has enabled children to be in school, and wherein families have access to health care And at the same time, the nutritional status of the family in terms of their dietary basket has changed remarkably in those households, whereby they are receiving cash, a predictable income per month for that family.
What will success look like for this programme, and when will it be achieved?
The Programme of Cooperation is for a 5-year term, which started in 2008, and pretty soon we should be doing a midterm review. So between now till 2012, the child, Joe, will have access to a birth registration and a birth certification. The legal framework in protecting Joe's rights is available. Joe will have access to social protection, wherein Joe, who is in that environment, haven't got access to education. Joe will now have access to schooling, wherein the teaching and learning materials that are non-existent will be made available to Joe in his own environment. Joe has access to immunization, and of course Joe will also have the community in which Joe lives. There is now some sort of parental responsibility and community responsibility in preventing and responding to every child rights violation. So we're looking forward to how best do we build upon those gains, taking into account the opportunities and the commitment of government in ensuring that Liberia is a place fit for children.
To support UNICEF's work in protecting the rights of all children, go to www.unicef.org.uk/donate.